भारती न्यूज़, सीधा, सटीक और निष्पक्ष।
Undoubtedly leave a lasting impact, and we are deeply grateful for your time and efforts in our being here. Once again, a very warm welcome and thank you for joining us.
Hello everyone. So thank you for having me first of all. I am Dr. Alka Daya and I practice as a gynecologist as well as a gynec oncologist at Max Hospital Shalimar Bagh. So gynec oncology is nothing, it's an upcoming subspecialty where we take care of women's health and also we deal with all kind of cancers that affect the female genital tract and the reproductive system. So we mainly deal with the cancers of the uterus, ovaries, vulva, vagina and cervix. So just 10 days back, one of my ex-mentors, Dr. Neerja Batla, who heads the gynecology department at AIIMS Delhi, was awarded with Padma Shri, and this was given to her for her exceptional work in the field of cancer care and especially cervical cancer. And why do we talk so much about cervical cancer? Why is it so important? Why is it everywhere? So basically, you might be surprised to know that cervical cancer is the most common cancer affecting women worldwide. And India forms the maximum burden of it. Being a developing country, being a country where a lot of female population still lives under the poverty line or has a poor socioeconomic status, cervical cancer continues to kill a lot of women on a daily, on a yearly basis. And the good and the bad part about this is, the good part is that this cancer is the most preventable cancer also. This is the only cancer which has a vaccine to it. A single dose or 2 doses of vaccine given between the age of 9 to 14 years give you 100% protection against this fatal disease. And the bad part is that even though it is so preventable and we have numerous campaigns and camps and awareness programs running throughout the country, the case burden still affects millions of females. So let's just, talk about the preventive measures we can take, the screening programs and what it is about HPV vaccine which makes it so important. So I have a very young crowd in front of me, but it is still very important to know that there are certain risk factors which can affect even the age group of 30 to 44 years. Most of the cancers occur beyond 50 years of age, but this is one cancer which affects sexually active females. And the prevalence is most common between the age of 32 to 50 years. But it can occur in females as young as 20 to 23 years and as old as 70 years. So it is very important to know that what are these risk factors. So poor sexual hygiene, multiple sexual partners, increase in the number of childbirths before a certain age, certain genetic conditions, smoking, a long-term use of oral contraceptive pills, early childbirth, all these puts a person at an increased risk of cervical cancer. And what is common among all these risk factors is the HPV virus. HPV is nothing but the human papilloma virus, which causes 80% of the cervical cancer and most of throat cancer, tongue cancer, anal cancer. So it becomes very important for us to know that what actually causes the spread of this virus. And the most common cause is sexually active people practicing unhygienic sexual intercourse or not using the contraceptive methods, not using barrier contraception. So this becomes very important for us to know that we can still prevent it by taking certain measures. So this is the burden I was talking about. The most common is, it's not actually 15 to 44, but it is actually 30 to 44, but it can affect young people as well. And HPV virus, like I said, is the culprit here, and the most common strains which are responsible for the cancer are the HPV virus 16 and 18. So like I said, the most common mode of transmission is sexual transmission, but it can be transmitted from mother to child during delivery, or it can have a fomite or surface transmission. So what are the signs and symptoms? So recently a 24-year-old sexually active female, unmarried female landed in my OPD saying that my cycles have suddenly become very irregular and I'm having this intermenstrual spotting and I'm having spotting after sexual intercourse. So these are some of the alarming signs and symptoms which need to be taken care of. It's not that everything is related to cancer, but yes, these are some of the signs and symptoms that we can keep in mind. So what are these? There is sudden abruption of the cycles, intermenstrual spotting, post-coital spotting, putting out discharge. If suppose you have an old female in your family who is beyond the age of 50 years, has stopped menstruating years back and suddenly comes and tells you, beta, for the last 2 or 3 days, I don't know, I have started bleeding again. I'm having this foul smelling discharge, offensive discharge. So these are the things you need to take notice of and report to the gynecologist or the oncologist immediately. So once you reach the hospital, the next step is the diagnosis. How easy or difficult is it to recognize cervical cancer? So the first step begins at home by recognizing these signs and symptoms, and the second step is to go to the doctor and tell about your condition. So the doctor usually performs a local examination, a gynecologic examination, and maybe she can do something called as a pap smear or a HPV testing, which is useful in screening for such conditions. So the most common taboo which is associated with this cancer is that these cancers cannot be treated. Most of the females would be in their age group of 60-70 years. They would have been having symptoms for time immemorial, but they are so ashamed of their symptoms that they do not go to the doctor. They are ashamed of telling their problems to their young children, and so they continue to suffer in silence, and by the time they land in the hospital, it's already too late. So it can very well be treated. In fact, the treatment is easier the earlier you report to the hospital. The early the stage is, the easier is the treatment. And the treatment can be anything from surgery to radiation to chemotherapy. It all depends on what stage you are coming in. So the most important part why I am here is to tell you about how this can be prevented. So first is educating the youth. It is very important for you to know that something like this exists in the first place. And secondly, what are the signs and symptoms which one can have if the person is affected by it. Second are the screening programs that are now available in each and every tertiary care hospital. We have pap smears which are now being done from 21 years of age every 3 years, and we have HPV testing which is done after 30 years of age every 5 years. So one thing that I would like you to know is that there's a lot of information going around on social media, get yourself tested, go to the doctor, this and that. But it is very important to know that 70% of the sexually active females will harbor HPV virus till the age of 30 years. So if you are 27-year-old, you go to the hospital, you are HPV positive and you are like very anxious, what to do now? So you will kick out this virus out of your body by the age of 30 years. So that is the reason we do these tests only after 30 years of age, because that is when, if the virus is continuously persisting in your system, that is when the risk of developing something related to this virus increases. And third and very important is the vaccination, where we can prevent it altogether from the very pre-invasive stage of it. So primary prevention is what we do through vaccination and educating the youth. Secondary prevention is when there are certain symptoms, you have screened it in time, it's very early and you can get it treated. Tertiary prevention is when you have already developed an advanced problem and now you require some specialized treatment to deal with it. So about HPV vaccination, it's very important to know first of all that we have a vaccine today, it is available everywhere. The costs are very much marginalized, and just 2 doses of it, if you take between the age of 9 to 14 years, it's like a small tetanus injection, 0.5 ml, one shot in your arm and you are good to go. One shot today and one shot after 6 months. There are absolutely no side effects as such. Maybe some mild fever or myalgia, but almost nothing more than that. It is 100% efficacious, not just against cervical cancer, but any cancer which is related to this HPV virus. And they say that if you vaccinate 90% of the girls of the country, you are indirectly providing herd immunity to the boys as well. Because it is not very economical to run a vaccination program for both the genders, but if 90 to 95% of females get vaccinated, they give their protection to the boys. Because throat cancer, anal cancer can occur in any gender, it's not cervical cancer only. So we have what we are giving in the hospitals is mainly the Gardasil vaccine. This is the quadrivalent vaccine, covers 4 viruses. The main agents of cervical cancer, anal cancer, throat cancer, warts-like lesions on the private areas. And this is given at a cost of approximately 3,500 to 3,800. And 2 doses if you are below 14 but more than 9 years of age, and 3 doses if you are anywhere between 14 to 45 years of age. Yes, we can give this vaccine up till 45 years of age, whether you are sexually active or not, whether you are married, whether you have kids, it doesn't matter. Some amount of protection will still be given by this vaccine up till 45 years of age. So this is what we should know. So these are the screening schedules. So why do we say कि 9 to 14 year में ही देना है? वो age group इतना important क्यों है? It is because in this age group the females are not yet sexually active, so the exposure to the HPV virus has not occurred, and this is nothing but live particles, so they trigger a response when the HPV virus hits you and protects you from that disease. So once the patient becomes sexually active or harbors a disease that is related to HPV, the protection comes down. And screening, like I told you, under 21, obviously there is no testing required. If you are 21 to 30, do a pap test every 3 years. It's nothing. It's a very small examination. There's a brush which takes some cells from your vagina and from the cervical area. It's absolutely pain-free, 1-minute procedure, and it gives you all the information that is needed, and you are carefree for the next 3 years. And if you are more than 30 years of age, just to make it more practical, more economical and feasible, because not everybody wants to go to a hospital even if it is once in 3 years. So you can do a HPV testing, and then if it is negative, then no need to do anything for the next 5 years. So it becomes a little more practical, a little more expensive, but it is worth it, I believe. And if you are more than 65 years of age, you have never had a problem, all your previous tests have been negative, then nothing to do, no need to test after that. So yes, it's very important that we know about this. A lot has been said about cervical cancer. A lot of campaigns are going on throughout the country. People are winning awards for it, and we have a major bulk of this disease. So I think it's important that you know and you transfer this information to your friends, your mother, your sister, your grandparents, because it can really bring down the healthcare burden of our country. Thank you so much.
If anyone of you have any questions, you can ask. Any type of question. How many of you are vaccinated against this thing? How many of you? So six out of this audience. So that gives us a sign that we were not aware, and now since we are aware, we must go for this vaccination. It has become essential, and you must aware your near and dear ones and the people around you also. All right? Have you understood the session? Yes. Girls at the back? Do you have anything to ask?
No.
Are you scared of anything? So we'll go for it, huh? Alright. So on behalf of BBI family, and I would like to thank Dr. Dhaiya for coming over here and awareing us on such an important issue. And we have become quite enlightened, as even I was not very much well aware. And we will go for this vaccination, and we'll take all such precautions. Thank you very much, doctor. Thank you all of you.